was thinking if there's any food that I should take more or avoid to alleviate my pain.
From the Western medicine model, we do not have any food that you should avoid. We say all nutritional foods are all fine. But when we talk about nutritional food, we're talking about food high in proteins, vitamins, and minerals, as well as amino acids. So from the Western medicine, from the traditional Chinese medicine model, they will have specific things like, say, certain foods tend to be a bit more cooling, certain foods tend to be a bit more heaty. So a woman whereby their menstrual cycle is very irregular, the TCM might suggest to say that, you should avoid the cooling food, you should avoid the more heaty or the more warming, uterus warming kind of food.
I wanted to ask if exercise will actually help in the pain.
That's an awesome question. For exercise to be helpful in treatment of painful menstruation is that we need to be, number one, the intensity of the exercise must be adequate. At least 20 minutes, if not more, before endorphins and noradrenaline are released. If you do less than 20 minutes, you most probably will not get any effect. Secondly, the heart rate during exercise must increase from the basal heart rate of maybe 70 to 80 per minute, which is normal for everyone. It has to increase up to 1.5 times the basal heart rate. Then you are truly achieving something to help the body to be able to fight that painful prostaglandin release. You can go to jogging, swimming, badminton, you can do squash, you can do breakdance. So all these things are all very helpful. As long as we achieve those two principles, you will be able to get a good outcome in controlling your painful menstruation.
Is it okay for me to do it when I'm having a menstrual cycle, or I have to do it before menstrual cycle?
I'm often asked this question. It's very safe to do that. It's not a problem. It's just that to the woman, when she's exercising, when you're having menstruation, you feel that it's clumsy, it's uncomfortable, it's awkward. But actual fact is not harmful.
What is the best way to lessen the pain?
What you can do is what we call healthy living. You have already recognized and you have mentioned some of the things that actually brings on the painful menstruation. Number one, stress. So learn to work with your stress. Learn to identify stressful conditions, learn to mitigate it, try to avoid it. Number two, have a good sleep habit, whereby you sleep well, you will be most probably able to manage your menstruation on the day one itself even better. Number three, hydration. We know that women whereby they are dehydrated, especially on the day one of their cycle, they tend to get even more pain than usual. And the last point is what I mentioned before, exercise. So you keep a regular exercise regime, it will really help you to be able to overcome your painful menstruation.
Alright. So I've heard from a lot of my friends who have tried the different painkillers and just different methods, but they're still experiencing menstrual cramp and it gets really bad. What would you recommend?
Yes. What you're saying is the last 10%. So this 10% of women with very severe pain, we know that even painkillers are not helpful for them, and they are very, very troubled, and the whole lifestyle is turned upside down. For this group of women, we usually will want to desensitize them because the uterus itself are all innervated by a lot of sensory nerves, and during menstruation it can be so painful that the nerves are what we call amplified, sensitized. So when they're sensitized, the pain is magnified more than usual. So for these group of patients, what we do is that we will desensitize the nerve. We do this via two options. Number one, we use medications to desensitize them, nerve stabilizers and muscle relaxants. And these are very unique medications. They are not the standard kind of painkillers. Number two, in selected patients whereby even that does not help, we can desensitize the nerve by injecting into the painful nerves that supplies the uterus. And these are very specialized injections. We call it neurolysis or desensitization of the nerves. So these are done via injections, no surgery, and we desensitize it and stop the pain. And that can give patients long-lasting 2-3 years of pain relief while they catch up with all the other rehabilitation and the convalescence to try to make their cycle back to normal.
When is the best time for me to acknowledge that I need to see a pain relief doctor?
If the pain is affecting you in severe manner, whereby your pain score we say is more than 7 out of 10, 8 out of 10, 10 out of 10, very severe pain. Number two, persistent for more than 6 months. So every month you are suffering from this pain at a very, very high level of pain. Number three, it not just gives you pain, it affects your activities of daily living, whereby your function is compromised. You're unable to go to work, you're unable to concentrate, you can't do studies, you can't do anything. And during those 3 days or the 1 week, you're completely debilitated. I think with all those factors in mind, you should be seeing me as a pain specialist to help you with your pain.